So if we're looking at yourself from behind, this is the back of your head. So here's the back of your head. This is the base of your skull, this black jagged line right here. And again, you would have your shoulder blades down here. You would have your shoulder blades on each side and then your shoulders. So there are muscles that run from the base of your skull down alongside your spine and attach to each one of these vertebrae all the way down on both sides. And then there are muscles that run from the base of your skull down along the side of your neck and come and attach to the top of your shoulder blade. So what happens in a headache issue is that something is causing these muscles, one or all of these muscles. So there would be 7 muscles that come to each of these vertebrae. 2 muscles that are coming from each shoulder blade up into your neck. So there's a lot of muscles. What's happening is that something is causing those muscles to get tight, to get tense. And so a muscle that normally is long and straight, what will happen is those muscle fibers will start to get knotted up on each other. And so when that happens, it's going to kind of rotate and compress everything together. So the first thing that occurs is that this space in between the vertebrae starts to get less. So it starts to cave in. You then start to get a pull on the muscles at the base of your skull. And then there are muscles in your skull or on your skull, on top of it, so underneath your hair and underneath your skin, between, very thin layer of muscle. Those muscles, when this muscle is pulling down, those muscles are being pulled as well. And it's that creates that compression in on your skull and ultimately in on your brain that causes the headache. But again, that external headache is coming from these muscles in your neck getting tight, pulling down, pulling on the base of your skull, creating a very small change, and then that tightness in those muscles in the base of your skull that's putting that pressure on it that ultimately causes that headache. How do you take care of all this? Well, the number one thing is obviously to get your headache under control, you need to get that muscle tension under control. You need those muscles to be more relaxed. Yes, it's great to find 10 minutes when you get home from work or at the end of your day and go lie down and lay in a dark room and get the pressure off and get that headache to go away. But the bigger question is, why did it come on in the first place? Well, what's happening is in those muscles in your neck, those muscles, they should be straight fibers. And what's happening is those muscle fibers are getting all knotted up and balled up on each other. They relax, but they still stay in that knotted, balled up state, which is why you get a headache a day later, a week later, or whatever it might be. So what you really need is for a physical therapist to use their manual treatment skills to get into those muscles and realign those muscle fibers. Now you're going to say, I could do that with massage. The answer is yes, you could do that with massage. It will take those muscles from being tight and guarded, and it'll get them to relax, but they'll still be all knotted up on each other. That requires some very specific manual skills that only a physical therapist possesses. Get those muscle fibers to realign with each other, and lo and behold, not only do your headaches go away, but the headache isn't going to come back. The problem that's causing it to keep coming back is now going to be taken care of. Best of all, you prevent yourself from having future neck problems or developing migraines, etc. In addition to that, once those muscle fibers get lengthened out and straightened out the way that they should be, we need to make sure that they stay stretched out. You need to learn some strategies. If you ever start to feel a little bit of a tension there, because it's going to happen, what do you do right away that keeps this from starting all over again with those muscles? And then more importantly, the stronger that a muscle is, and these are muscles that are, again, like the size of your thumb that are holding your bowling ball head on top of your shoulders, the stronger that muscle is, the better job they're going to be able to do to hold your head up. So that again, as you're sitting at the computer and gravity takes over the course of the day, and this is where you end up, you can tell yourself, sit up straight. 30 seconds later, you're right back into that same position if those muscles aren't strong enough. So the key to getting your headache under control and keeping it from coming back is get those muscle fibers to be lengthened out. Again, only a therapist trained in manual therapy skills can do that. Get those muscles to be long so that they stop pulling and putting that pressure. And then more importantly, get them to be good and strong so that they hold you upright. You don't have to tell yourself, sit up straight all day long, sit up straight when you're in traffic, etc. And then even when you get stressed out at work or with the kids or whatever it might be, those muscles are stronger. They don't need to tense up to handle that stress the way that they do. And before you notice, your headaches are going to be gone and you're not going to be having headaches anymore. So if you're having any headache problems, internal or external symptom-wise, any headache symptoms, any progression of symptoms, etc., give us a call here at Loudon Sports Therapy Center. That's what we do. We get the problem under control so that you feel better, but then we make sure that you know what to do long-term so that A, it's gone, and B, it's not going to come back and it's not going to cause you any future problems.